Good morning, fellow Toastmasters. After last speech, I discovered an area of mine that I'm very passionate about and learning more about. This area is Medicare and Medicaid. Now, keeping with the theme of my last speech, it's important that we avoid all the narratives that could be involved when discussing this controversial topic, as the healthcare cost crisis is really affecting families all across the board and individuals all across the board in the United States of America with how expensive healthcare is. So, with that, I'm going to introduce the topic of Medicare and Medicaid. Now, Medicare and Medicaid is very important for us to define what it is so we can understand the suggestions I will make and why it's not necessarily the best program of the United States government. Now, this isn't to say that government involvement in healthcare is bad. That is not what I'm saying, and that's a narrative we need to very truly much avoid. This is to say, however, that there are functions in public policy involved with Medicare and Medicaid that don't work the way they should and ultimately lead to a rising cost through lack of incentives. Now, also, I want to thank Shannon today for bringing up her marvelous tip of healthy living. That is what's going to help us all live better, healthy lifestyles and also help us spend less on healthcare later on in our lives. However, there are some areas of public policy that need help as well. Medicare and Medicaid are both programs, Medicare, federally run, Medicaid, state run, but also receives federal dollars, that are meant to provide an insurance service for elderly, disabled, and in many cases, lower income individuals. Now, this insurance service is relatively cheap compared to the rest of the market. Whereas premiums may run $400 a month with a $1,200 yearly deductible on Medicare and Medicaid, on the open market, you may see $600 a month plus an $8,000 yearly deductible. So it does provide a little bit more advantageous plans to those who might not necessarily be able to afford it. Now, I want to go over the issue of why Medicare is a major contributor to healthcare cost crisis in the United States of America. The big reason is that it tends to confuse the incentives involved in each party that is going through Medicare and Medicaid. And there are three parties: the provider, the payer, and the patient. Each one of these has a different incentive, and the way these incentives are set up causes the cost to rise exponentially. Now, I'd like to share my screen here to explain my first concept. There we go. So I love economics. I was in fact a minor in economics. And a famous economist, more from the laissez-faire perspective, named Milton Friedman, opined a matrix about how money is spent and whose money is spent. 4 different ways. You spend your money on yourself. Therefore, you economize and seek the highest value, meaning you want the lowest cost for the highest value. You spend someone else's money you spend your money, my apologies, so top right matrix right there. You spend your money on someone else. You just seek the lowest cost, but you don't necessarily seek the highest value. You spend someone else's money on yourself, and therefore you seek the highest value, but you don't care about cost. And you spend someone else's money on someone else. And that is where you don't care about cost and you don't really care about value. So in this situation, we have 3 parties at play. We have the patient, the provider, and the payer. Payer of Medicare and Medicaid tends to be the government. Each person has a different role in this matrix. The patient, in many cases, faces the standard cost that they always will, a fixed deductible and a fixed monthly premium. So they always pay the same amount no matter what. In many cases, the cost of their treatment often goes on to the government, and therefore they don't economize, which means they don't really worry about cost, but they also seek the highest value. Now, the payer, the government in this case, is spending someone else's money on someone else. Someone else's money being the taxpayer, someone else being the patient. So they could care less about the value, and they also could care less about the cost. Now, we have a third party here that fits outside of this matrix, and that is the provider. Now, again, let's avoid the narratives. Profit incentive and competition in medical services isn't necessarily a bad thing. It's understanding how we help that profit incentive and competition. But if you were a provider and you knew that no matter what, the patient was going to say yes to a certain service because they'd have to pay for it, and that no matter what, you were going to get paid for it, you are tend to be incentivized to offer services that don't really do much for the patient, but only seek to improve your own bottom line. Now, let's jump to the next slide here, which describes my point in that field as well. Often, this is the diminishing rate of marginal returns, very popular economic theory. You tend to learn it on your first 1 or 2 economic classes. But how it works is so the x-axis in this case would be money spent. The y-axis would be utility gained from healthcare services. So on the first, let's say $1,000, that one down there, you tend to gain the best proportion of utility from your healthcare providers. To get the next, I guess, our like smaller amount, the diminishing amount, you have to pay another $1,000, and so on and so forth. Eventually, the returns on this minimize over time. So you've already reached a maximum amount of output, or not a maximum amount of output, but a reasonable level of output, and the provider is incentivized to offer you a larger and I guess better, but very marginally better service for much more expensive costs. Of course, over time, this builds up and compounds, and costs rise exponentially in the United States. With a failing incentive system as such, it is important to understand that the reasons why Medicare and Medicaid don't work aren't necessarily because the government involved in healthcare, but they fail to address each party's incentive for treatments. Understanding this helps us move forward to propose better policy solutions. Along with living healthy and along with understanding how current policy fails, we can develop new policy for the United States of America to help lead us to end the healthcare cost crisis. Thank you.